I am Community Chloe of Radio 1 Richmond Stations, and Her Story RVA, we're back, is a virtual women's empowerment series curated with Black women in mind. This episode is sponsored by Virginia Neonatal Perinatal Collaborative. We are back with Her Story RVA. This evening, we will be discussing how to navigate through uncertainties with high risk pregnancies and bring awareness towards preeclampsia, as May is Preeclampsia Awareness Month. Did you know preeclampsia affects approximately 5 to 8% of all pregnancies in the US? And tonight, we are joined again with the founder and executive director of Urban Baby Beginnings. She is Stephanie Spencer. And also joining us is Urban Baby Beginnings' very own community doula. She joined us back in December, Candace McDaniel. Welcome, the both of you.
Thank you.
Thank
We're
you.
glad to be back.
Thank you so much for being here. And I'm so excited to introduce our very special guest that is joining us. And we're going to have a serious discussion. And we want us all to tap in as she share her knowledge and experience as she continues to bring awareness towards preeclampsia. Welcome, Dr. Nicole Rankins. How are you?
I'm great. Thank you so much for having me. I'm excited to be here.
All right. So, Dr. Rankins, we're going to
Yes.
start with you. We just want you to give us a brief sum up, a little bit about your bio. Tell us about you.
Sure. So I'm Dr. Nicole Calloway Rankins. I am born and raised in Virginia from the 757. I grew up in
Oh,
Hampton, and I'm a proud HBCU graduate. I went to Spelman College in North Carolina A&T, where I majored in math and mechanical engineering. Came back home to Virginia after went to medical school in Virginia and have stayed here to practice. And I've been in practice for 20 years, hard to believe. And I've had the privilege of helping over 1,000 babies into this
wow.
world. I love what I do. I am here to be of service. And I do that not only at the bedside, but online. I have a popular podcast called All About Pregnancy and Birth as well. It's been downloaded over 1.5 million times.
Wow. Dr. Rankins, thank you so much for being here and all you do. And Stephanie, you're no stranger to Her Story RVA. So, briefly, tell us a little bit about you and Urban Baby Beginnings.
Sure. And again, thank you for having us. I'm a registered nurse. I've been a registered nurse since 2008. I'm also a mom of three. I'm the founder of Urban Baby Beginnings, which is really a social support program that works to support pregnant and postpartum people from pregnancy all the way to the second birthday. And so we can't thank Dr. Rankins and also Radio One enough for your efforts to continue to
Yes,
spread awareness of pregnancy and the things that and challenges that families tend to experience.
and our very own community doula, Candace Daniels. Welcome. Tell us a
Thank
little bit
you.
about you. You're our community doula.
Absolutely. Thank you so much for having me. I am Candace. I'm a community doula, certified community doula with Urban Baby Beginnings. I'm also a mom of three older adult children. And I'm just excited about all things baby, assisting moms and families and making sure that they are fully supported during that pregnancy and postpartum period.
All right. Thank you so much, Candace, for being here. Thank you for all of our viewers that are joining us tonight as we're talking about community support for our mothers, birthing people. We're going to get started with the conversation now. According to the CDC, preeclampsia is a leading cause of maternal and fetal morbidity and mortality. Dr. Rankins, can you explain to us what exactly is preeclampsia?
Yes, so preeclampsia is a condition that develops during pregnancy, and it has high blood pressure as well as affecting other organs. Most often, it affects the kidneys and the liver. And it's typically going to develop after the 20th week of pregnancy. So it's something that usually happens in the third trimester of pregnancy. But what a lot of people don't realize is that preeclampsia can also happen postpartum. So
Ooh.
you can go home and then later develop preeclampsia as well.
Wow, thank you so much for sharing that with us. Now, ladies, tonight we are here to tap into this conversation about preeclampsia since May is Preeclampsia Awareness Month. Now, in your own words, can you explain to our listeners why this awareness is so important? Let's start with you, Stephanie, Candace, and then Dr. Rankins.
I think one thing that people don't realize is that the diagnosis of preeclampsia has lifelong implications as well. And so we want to be sure that people are connecting with their providers and getting the support that they need so that they know what that means. But also, too, the implication to pregnancy and the postpartum period, can affect someone's health and it can affect their baby's health. And so we want people to know why it's important to engage with their providers early on and when they recognize that there are challenges so that we can have healthier outcomes.
Candace?
As a doula, I think it's very important. I get to see firsthand the impact of preeclampsia. I also see that things change very quickly when we're dealing with the diagnosis of preeclampsia. So knowing those symptoms and having those conversations with your doctor so that you can get a plan of action is very important before we go into crisis mode.
Thank you, Candace. And Dr. Rankins?
Yeah, I want to reiterate what Stephanie said. We don't appreciate the long-term implications of preeclampsia well after your pregnancy. It does lead to an increased risk of heart disease later in pregnancies, or later in life, rather. So you definitely want to monitor that. And then the other reason we need to bring awareness to it is that, unfortunately, we as a medical profession don't always pay serious enough attention to preeclampsia. It's one of the reasons that pregnancy problems and mortality happen is because things aren't recognized, treated in a timely fashion. So I want everyone to have this information so that you can advocate for yourself if need be, because it can truly be life or death.
Is there more research being done when we talk about the science? Does the preeclampsia, has it affected any babies that you know of?
Yeah, so preeclampsia is primarily a condition that affects the mother. So
Yeah.
it affects the mother, but then it can have some impact on the placenta, which can lead to issues with the baby's growth. It can lead to the placenta not providing enough nutrients to the baby. But most often, if preeclampsia, after it affects mom, it can affect the baby's growth, will be the next issue that can happen.
Okay. Dr. Rankins, thank you so much. Preeclampsia is more common in first-time pregnancies, women carrying multiple fetuses, and women who have certain underlying medical conditions such as chronic hypertension and diabetes. Stephanie, can you touch on this and the type of resources and services MQCA and UBB provides for women with preeclampsia?
Absolutely. And we really talk about this because, as Dr. Rankins mentioned, it's kind of a village approach to care. It's not just about the provider knowing what's going on and giving timely treatment, but also, too, many times what's happening is in the community, we don't recognize what's happening. So we're not hospitalized. We just know that we're not feeling well or something's different. And we're not really connecting the symptoms to the potential that there's an issue such as
Yeah.
preeclampsia. There are a lot of resources. There's a Preeclampsia Foundation, or preeclampsia.org that gives information about preeclampsia for workforce providers, such as doulas and others who may need to know what to do. But also for the moms, we really talk about our home visiting programs, Urban Baby Beginnings being one of them, and our community doulas as peer support. Because when we're not sure, often enough, what we do is we reach out to a trusted member that maybe has been working with us in the past to say, hey, what do you think? And so at Urban Baby Beginnings, we train all of our doulas on how to recognize signs and symptoms of preeclampsia and hypertension and how to talk about it prior to it becoming an issue. But the main thing that people have to recognize is that support is through systems such as home visiting partners and community doulas who are trained in working with pregnant and postpartum people.
Thank you, Stephanie. Preeclampsia is more common among Black women in the U.S. with an estimated incident rate of 53.8 cases per 1,000 births, live births, that is. So, Dr. Rankins, can you tell us more in detail about how common is preeclampsia, some of the symptoms, and what the risks are?
Yes. So, as you mentioned at the beginning, it happens roughly 5 to 8% of pregnancies. Black women are more affected. A large part of that is due to racism. Multiple studies document how Black people are treated differently in the healthcare system just based on race alone, and your income and your education does not protect you. So being Black and the racism that we can experience is a risk factor for sure, which is why it's even more important that we have this village approach to help support one another. And then some of the other risk factors that can put you at increased risk for preeclampsia are if you carry extra weight. So if your body mass index is 30 or above, that will increase your risk of preeclampsia. The extremes of age. So if you're very young getting pregnant, like a teenager getting pregnant, or if you're 40 and older getting pregnant, that can increase your risk of preeclampsia.
Wait a minute.
If you have if you have a family history, if you yourself had preeclampsia in a previous pregnancy,
Mhm.
all of those things can increase your risk. But really just being pregnant, we all just need to be aware of this, because this is one of those things, and we'll probably chat about it later, that when we intervene, it helps improve outcomes.
Wow. Be an advocate for yourself, in other words.
1000%. You have
Yes,
to be. Yeah.
absolutely. Candace, it's great to have you back for another episode. For our new viewers, you can remind them, what is a community doula and what does it look like to you day to day?
Oh, thank you so much for having me back. It's definitely a pleasure being here. A community doula is a trained birth companion. We provide additional emotional and physical support for moms and families during their pregnancy, labor, and that postpartum period, making sure that mom is fully aware of the processes, as well as advocating for themselves and protected, like Stephanie said earlier. We develop a relationship with the moms so that they trust us and they know to reach out. They have someone to reach out to in the event that some issues may arise, and they don't feel comfortable reaching out to their doctors or their medical providers, or they're not sure if it's something that they should reach out to their medical providers. They can reach out to us. Day to day, our schedule is definitely up in the air. I might spend the day spending time with a new mom or pregnant mom, figuring out what the birth plan is going to look like, what she wants her birth story to be. And maybe in a labor, actually helping mom and families physically getting through the labor to bring in a healthy baby, or that postpartum period, checking in with mom, doing wellness checks, lactation support for moms, making sure baby's eating
Wow.
well, and mom is taking care of herself and not feeling overwhelmed. And also looking for those signs and symptoms of preeclampsia or some of the other health issues that may affect postpartum moms.
Wow. Candace, thank you. And I want to throw another question at you. Can you touch on the things that you've experienced as a community doula and the impact it has had for women and families with preeclampsia?
Absolutely. I think, as I said before, preeclampsia, it can change that birth story very quickly. When we see moms that get preeclampsia, especially later on when they are experiencing those severe health effects, things change very quickly, which is one of the reasons why we want moms to recognize those symptoms so that they can speak with their healthcare provider and get a plan of action. But after those symptoms come and things change quickly, we may be dealing with moms delivering early, having a preterm baby, which can in itself be very overwhelming. So we have to look at how mom is supported during that time, what that's going to look like, who's going to support mom, who's going to support families, who's going to support the baby during that time. And also, if mom is experiencing additional health issues, what does that look like for the family? Who's there to help them navigate that system so it will not get overwhelming during that time period?
Thank you so much, Candace, our community doula. It's important for our listeners to know about their options and community resources they have around them. How does MQCA continue to make sure maternal mothers know they're not alone and how to help to navigate the uncertainties?
So
Stephanie.
the Maternal Quality Care Alliance was built by 6 founding partners that have statewide presence, and they provide direct support and resources to individuals and communities. And the reason why it was so important for us to come together is that, based on just the voices of many moms across the state, that was the one thing that they elevated, was that they didn't know what the support systems were and what the structures were. And so by us coming together, we're really focused on, between the MQCA, Virginia Neonatal Perinatal Collaborative, building safer systems of support across the state at the community level, but also in the hospital systems. And we're very, very committed to ensuring that that happens, which is why we're also so focused on providing health education, resources, and connections through these presentations as well.
Mhm. Thank you so much for that, Stephanie. Can you share with us what are some signs and symptoms of preeclampsia and how early detection and prompt management can help improve outcomes for both the mother and baby, Dr. Rankins?
Yeah, so this is really important. First, you have to have high blood pressure. So if that top number, that's systolic blood pressure, if that top
Mhm.
number is 140 or above, then that's concerning. If the bottom number is 90 or above in pregnancy, that's concerning. If
Mhm.
that top number is 160 or above, that definitely needs to be treated right away. That puts you in danger territory of a seizure or stroke. That's called eclampsia. That increases the risk for that. That's severe preeclampsia. And then if that bottom number is 110 or above. So really, if you just remember 140 over 90, anything above that is concerning. Some other things you may see are protein in your urine. You may have visual changes where you're seeing spots or something just looks funny or blurry. Headaches are a common sign of preeclampsia, and it's headaches that aren't relieved by Tylenol. So if you have a headache and you try some Tylenol and it goes away, then that is probably not preeclampsia. But if you have a headache and it sticks around, then that is definitely concerning. Swelling is a symptom of preeclampsia, but swelling is so common that's hard to tease out. I know when I was pregnant, I got swollen, felt like my behind swole the most, but that's a whole other story for another day.
Whole other show.
Yes. So swelling can be a symptom as well, but that's really common. So we don't get as excited
Yeah.
about that. Also, abdominal pain, especially up here in the right upper part of your belly, that's where your liver is. And if you're a preeclampsia can affect your liver. So if you have pain in the upper right part of your belly, that's also a concern. So when you have any of these things, bring those to the attention of your healthcare provider and be persistent and make sure that they're taking it seriously. It doesn't mean that there's nothing going, that there is always something going on, but you just don't want to feel like you're being dismissed. You want to be sure that they're investigating things, they're looking at things, that they're really taking things seriously when you bring your concerns to them.
And as you stated, Dr. Rankin, when we're talking about being a self advocate, and a lot of times folks in our community and who are on Medicaid, we need to get them on Medicaid so they can get some of the services.
Mm-hmm.
But, getting a blood pressure apparatus at home, and if something doesn't happen or something doesn't feel right, and I'm pretty sure you all can attest to that, when you do go back to the doctor and you potentially face that racism, like there's nothing wrong with you, you can say, I did 3 readings of my blood pressure and it's
Yes.
140 and 90. We can start
Yes.
there,
Yes,
right?
absolutely.
Okay.
Yes. And we're trying to actually give people blood pressure monitors so
Uh-huh.
that they can monitor their blood pressure at home, give them for free. That was one of the, if you can find such thing, blessings from the pandemic, is realizing that telemedicine and
Yeah.
helping people do things at home, those things are being developed and more progress is being made in that area. So you can check your blood pressure at home. Now, you ain't got to be checking your blood pressure, 10, 12 times a day or anything like that. I don't want you to get overly, but yeah, check it in the morning when you wake up, check it in the, in the evening, just to keep an eye on it if there are any concerns.
Because you have to have something when you go into that doctor.
Yes, yeah, you do, and you want to go in and you say, look, I'm concerned. I'm concerned about preeclampsia. I'm scared. Make them see you as a human being in front of you who needs help. Most doctors go into medicine because we want to help people. I think for a variety of factors, sometimes we lose sight of what we get into this business for, whether, too many patients or this, that, and the other. So bring it back to that human connection. Doc, I'm concerned because my blood pressure's high. I'm worried about preeclampsia. And I've heard about how scary that is. I don't want to die during my pregnancy. When you say things like that, it helps people to realize and take things serious.
Hope they take note on that. Candace, thank you so much, Dr. Rankins. I really do appreciate you ladies being here today. With the importance of early detection for a maternal mother to know there is someone always there to help in all areas, how could someone go about finding a community doula through UBB?
Absolutely. Urban Baby Beginnings, we try to make it nice and easy for community members to get in touch with us. Our website, urbanbabybeginnings.org. clients can self-refer themselves. So you don't have to have a referral from your doctor or your medical provider. You can go directly to the website, hit that tab, put your information in, and we will contact you, get all the information that we need, as well as send information to the insurance to make sure you are fully covered.
Well, Candace, thank you. And even though you do have family, we have villages of families that have been around us. My whole family was there the whole time. But even if you do have that village, it's still, don't you think it's still a great idea to have a doula, Candace?
Absolutely.
Okay.
Absolutely. I tell my clients all the time, I am here to support you as well as your family. I don't take the
Oh,
place of your family or your partner, but I
oh,
have a trained set of eyes so I can look for things outside of what your family is viewing. And I'm there to help all of you support the whole family, because pregnancy is a journey for the entire family.
mhm. Wow, we're going to be wrapping up shortly. Dr. Rankin, can you share with our viewers what treatment and prevention for preeclampsia and what does that look like?
Yeah, so prevention, one thing I want to echo the importance of a doula. Doulas are not just like we think it sounds good. There's actually
Right.
research that shows that having a doula improves pregnancy outcomes. So that
Okay.
is really important, that village
Yeah.
approach. Also, with prevention, the only thing that we have shown that can really reduce the risk is taking a baby aspirin during pregnancy. So if you have some of the risk factors, you want to take a baby aspirin. I get DMs about this a lot. People are concerned about whether or not it's safe. It is safe. Baby aspirin starting around 16 weeks of pregnancy, continuing through the end is safe. So take that baby aspirin if you have risk factors. And most Black women are going to have enough risk factors that they should take baby aspirin during pregnancy. And then treatment, unfortunately, the only treatment is delivery. So we try to
Mhm.
get the pregnancy as far along as we can, but the only
Yeah.
treatment for preeclampsia is delivery.
Dr. Rankins, thank you so much. We're going to be winding down. So we got about 3 minutes to go. I want each of you, let's start with you, Stephanie. How do our viewers gain more access to your resources and services? And if folks have any questions, how can they contact you?
Mhm.
Stephanie.
So the main thing that we always tell people is, regardless of whether or not you know that you qualify or not, the first step is just putting a referral in on our system,
Mhm.
because we have navigators that connect with services even if you may not qualify directly for ours. And then we also have individuals that can talk through what are kind of the next steps. So what we want to encourage people to do is either go to our website, they can give us a call. We have a 24-hour 24/7 line. They can answer questions related to some of the common questions that families ask and get people connected right away. And then the other thing that we want to be sure of is that folks know that even if you may not have Medicaid, you may have commercial insurance, or you may be uninsured, there are still support systems for you. That's why we want you to go ahead, pick up that phone, go ahead and make that referral in, and we can make those, we can help you to make those decisions about where you're going to go, regardless of what organization that is, and regardless of whatever insurance type you have as well.
Thank you so much for that, Stephanie. And Candace, I know you're with UBB, but any particular access to resources for our viewers?
Stephanie covered all of them.
Pretty much did at UBB?
Yes, we are
Can you
available to assist
uh-huh.
you anytime. We do have that 24-hour line. So whether you're watching this in the evening or you're catching a replay and you think about it, you can definitely go to our website and give us a call, and somebody will contact you and help you along on this journey.
All right. And Dr. Rankins.
Yeah, so my website is drnicolerankins.com. There I have lots of free resources, warning signs to look out for after birth, pain management options in labor. I'm on Instagram. That's my favorite platform, at Dr. Nicole Rankins, where I share information, do reels and videos, all that great stuff there.
Uh-oh.
And then, yeah, and then my podcast, that's my baby. It's called All About Pregnancy and Birth. Do check that out. It's on all the pregnancy platforms. I share birth stories, the good, bad, ugly, interview experts about birth, and then I talk about topics about birth as well.
Well, thank you so much for joining us, Dr. Nicole Rankins, Stephanie, and also Candace. We do appreciate you. Lots of great information shared here tonight. We want to thank our sponsor, Virginia Neonatal Perinatal Collaborative and Maternal Quality Care Alliance. And again, thanks to you, our panel. And we're going to be back. We're not over. God bless you. Thank you so much for being here. I am Community Clo for Radio 1 Richmond.